Welcome back to Morning Express. We are glad you're watching. It is now 8:35 a.m. on this 20th day of November. For the next few minutes, I'll be talking with the now ambassador, Dr. Stanley Kamau, joining us in studio this morning, CEO of Ahadi Trust. And I was about to say newly crowned. It's not crowned. It is. But now you're an ambassador. Talk to us about this huge honor that was bestowed upon you.
This organization, the ICIE, which is an affiliate for the Global or the World Council for the Talented and Gifted Children in the World.
Right.
And they didn't have a representative in Africa. And after looking at what I'm doing in this country, they decided to appoint me the ambassador for East and Central Africa, a role that I'm going to take up, and I'm sure I'll be able to manage and successfully do their work.
So ICIE stands for what?
It's the International Center for Education in Innovation.
Innovation.
Yeah.
So you're saying they're a global organization, they're based in the US.
Yeah,
How
they're
is
based
it
in the
they
US.
come to know about your work? How do they?
I think they've been following my work through the media and also through publications. And recently there was an item on CNN, the African Voices, and that's when they made a decision that I am the best person suited to do their work.
Okay.
Yeah.
So what will this work entail?
You know, there's one thing that we have a lot of talented and gifted children, especially from the poor communities, that their work never get to be seen, and they have never gotten an opportunity or a platform to be able to air or to be seen what they do. These are some of the things I'm going to be doing. I'm going to make sure that we're able to identify those people and somehow nurture their talents, and also try to see that their talents and gifts are going to be known by other people, so that we can be able to come up with a sustainable project on how they can be helped.
Yeah.
Yeah.
And you're seeing some of those pictures at the ceremony there when you were given that particular honor to, you know, represent, to be an ambassador. For how long are you going to be working with them?
We have signed a contract for about 5 years, which is renewable, but by then I think I'll have become old.
Okay.
Yeah, I believe in people taking the mantle to the next level. So I'm hoping by then someone else will have been identified to do the work.
I like that talking about talent, because that is one of the things we don't see a lot in our society being focused on. You see many people, kids, as they grow up, parents will be like, you know, what do you want to be? Everyone is doctor, and all these things are good, pilot and everything. But in terms of talent and just really what you're inborn with, what you have as you're born and what you can utilize to always make even a living from, I think that is a good place to even take the discussion in terms of encouraging it to happen in society.
What has happened is that if you look at the people, even the artists and such other people who have got talent, it's only those children who are fortunate to have come from very able families that are able to exploit their talents. But those from the poor families, we have seen children come up with good designs, music, poem and such other things, and very great talents. But no one goes to them to nurture their talent because their parents are poor, they don't have the capacity, they don't have the platform, they don't have someone to talk to. So those are the things I'll be looking at. I'll be looking at those, how we can be able to bring these people with talent and gifts to the community, to the society, so that the people can know who is able to do what and where. Like now you see, like these boys who are trying to make an aircraft. How come when they try and it fails, no one actually follows up to see what else can these people do? Instead of laughing at them, saying they have failed, they keep on trying. Is there a way that we can be able to get those people, see what kind of a course they can be able to undertake, and then maybe in future, they'll be able to make an aircraft. But what happens is that you are in here, you try, you fail. What else do you do? Those are the people who get now indulged in drug abuse and alcoholism because they are frustrated and they cannot be able to move further from where they tried.
So how is it you will focus and narrow down on who to help and assist? Because you can go to a room full of people and everybody claims to have talent and they all want the assistance of the ambassador and some money to help them to get to the next level. How do you narrow down?
We are now in the process of coming up with a strategic plan on how we are going to do this work. But initially, we are going to ask parents who think their children has got a talent or a gift to come out and register those children. And then the organization is going to bring machines, which includes computers, that are going to be used so that when you take to a child, the child will talk in front of the computer, take images of that child, and then there will be the unit that's going to be set at the headquarters that they are going to analyze what kind of talent or gift that child has. How they are going to do that, I'm going to learn, because I don't know right now. I'm still very new, and I'm not very technical into that. But this is something that has worked in other parts of the country. It's the first time it's been done in Africa. But I'm very hopeful that we are going to succeed. Yeah.
So Kenya not the only beneficiary. You're dealing with Central Africa, Eastern Africa as well.
Both East and Central Africa.
All right. So it's going to keep you very busy.
Yeah, I don't mind. And I keep on saying that God cannot give you a responsibility you cannot handle. So I'm very sure I'm going to handle it. And
must be a huge budget coming with that.
Yeah, it's a huge budget.
But do we know an estimate? Do we have a figure?
No, not for now. What I can tell you is that through the World Council for the Gifted and Talented, they are going to fund all those projects, and I can assure and I can guarantee the people that are gifted and talented that that money will only be used for the purpose is intended for, not for any other thing. So if people would want to get more information on this, will you then in the future be communicating with its website, how they can contact you? We are thinking of rolling out the program by mid of December or early January. And first of all, we are going to partner with all the county governments and also the central government through the Ministry of Education. So the project, we're going to have a lot of we are going to do a lot of awareness campaigns, and people will get to know where they can register their children, how they can come on board, and also we are going to look for young people that we are going to work with from different regions so that they can also help us identify those talents. All right. Yeah. And also just going with the name of the organization, ICIE, Innovation and Education Innovation, you have been, before this came, doing your own work. We've come to know you, the country has come to know you because of your campaign, anti-Jiga campaign around the country. But you've also been evolving, just trying to help others with now a new project you launched recently, the Ambulance Mashinani, and we'll be seeing some of those pictures. What inspired this idea? The Ambulance Mashinani, they are meant for the villagers, for those people who are actually cannot be able to afford transport to go to the nearest dispensary. What I realized that in the process of doing my anti-Jiga campaign, I've come across people who are disabled, others who have got no information of the nearest dispensary or medical facility, and some of them cannot be able to walk, and others cannot even afford transport. So I figured out that since we have motorcycles, what can be used with this motorcycle to create transport for these people? And that's why I came up with the idea of Ambulance Mashinani. I fabricated an ambulance that can be mounted on a motorcycle, and it's been working very, very well. I can tell you there are some people who have given birth inside the ambulances. We have taken children who are rape victims. We have taken other, even the dispensaries themselves. They have been calling our social workers on the ground to help them. And you realize that most county governments have got ambulances. And those ambulances, if you have an emergency, you must call a number. But the people we deal with, the people we represent, are the most poor in the community. They don't have telephone numbers, they don't have newspapers, they don't have anything. They actually don't know what's happening around them at all. So this is one thing that the Ambulance Mashinani is going to help. Social workers will identify those people who have never gone to hospitals, who miss on their appointments, who have never gone for medical checkups, and take them to hospitals and take them back. And in case of an emergency, our social workers will be able to call the county ambulances or hospital ambulances, then they can be able to meet halfway. Because our Mashinani, Ambulance Mashinani, it's not all that fast, but they'll have already undertaken and undergone first aid in the nearest dispensary. And they're able to access even where there are no roads. And you see it's fitted with a bed, which is portable, you can remove it. Those pictures, They are also fitted with a first aid kit, and also a maternity delivery kit. So just in case someone is pregnant and they are in labor, actually you can give birth inside that Ambulance Mashinani. And we have given to many counties. And which counties? Some of them just a few. We have given to Murang'a, we have given to Kakamega, we have given to Kiambu County, and many more other counties that we have already fabricated, and we are going to make sure that each and every county get an ambulance mashinani, especially those villages where there is more poverty.
Yeah, because that is perhaps, as you said, where the need is most. It is where you'll not see these other ambulances we see every other day.
We believe as Ahadi Kenya, we believe in taking the services to the people, not the people coming to look for services. And this one way that is very practical, and it's also cheap to learn because there's no extra cost, because the only thing is that our social workers have got motorcycles. So by mounting the ambulance mashinani on a motorcycle does not make any other cost. Maybe only you get a little tired of mounting, but there's no other extra cost. Yeah.
And are the county governments being involved in terms of just helping and meeting part of this cost? So there's also a responsibility on their part in as far as helping out, or is it this county government comes out and says we want some and then you deliver?
We have some county governments that have already given us proposals on how we can be able to partner, and we are going to work with them.
Yeah.
And not even on only county governments. We have individuals and organizations who have expressed their interest in having the ambulance mashinani.
Yeah.
And I'm seeing this becoming the other biggest thing for Ahadi Kenya in the next few years.
Yes.
Yeah.
So already some impact, you're saying. Deliveries in these ambulances you mentioned, already seeing impact in terms of just helping people at that grassroots level.
People have actually benefiting from the ambulance mashinani. And I can tell you that people ignore the simple basic things. But that person who is in their house, who have got no information about the nearest clinic, the nearest medical center, they have never gone, especially if you have disabled people and they are poor, they are not able to walk to the dispensary. And for example, there's one case of a boy who fell from a tree and he broke his leg. And then they put the boy on a motorcycle, taking him to hospital. The motorcycle had an accident. So the boy now had multiple fractures. And now he had the stigma of now getting into another motorcycle. So the ambulance mashinani, it creates a lot of dignity. You know, it is covered. That prevents you from exposure from dust and wind and such other things. It also takes you to hospital in dignity, in a way that if you had a broken bone, you can lie on the bed and you can be taken to hospital comfortably without people even interfering with you.
Yeah.
So this is something that, on my own judgment, it's working very well, and people are appreciating what we are doing on the ground.
Yes.
Yeah.
But everybody, as I said at the beginning, got to know you and you're introduced to the country with the Jiggers drive.
Yeah.
How is that doing? Are you still conducting those drives in different parts of the country?
I can tell you the anti-Jigger campaign has done very well, because about 2 weeks ago, the CS for Health was able to sign and give us a policy on Jigger infestation. Hopefully by next year, we'll have a Jigger Awareness Day. And that's why I was telling you that the anti-Jigger campaign is actually, now it's when we are starting eradication of Jiggers, because now we have partnership, and very firm partnership, with the Ministry of Health, Ministry of Education, and the county governments. In the next few years, I don't think, personally, I'll talk about Jiggers. I won't talk about control, prevention, and management of Jigger infestation. I don't talk about interventions. I don't talk about removing Jiggers from people's feet. No. I want to move to the next level, where it's about prevention and educating people on good hygiene practices.
Yeah. Why do you think it has continued to be a menace? Why is it has been there in the society for such a long time?
Jigger is a result of poverty.
Yeah.
And unless we address the issue of poverty, people in this country will still suffer from the Jigger infestation. Yeah. And
there are those who look at it, and some of your critics will say it is exposing the bad side of society that perhaps we should all keep quiet about. What do you tell those people?
I have no word to express. I can only say they are foolish. Because if your children are in school, your children have slept, haven't eaten, your children don't have any disability, don't talk about such issues. Don't negatively, because you don't know how those people are feeling. So anyone who comes out and saying that you are exposing our community, there's no disease that is actually patented by a community. You cannot say malaria is for Luos, Jiggers are for Kikuyus or such things. It's just stupidity. And this is one thing that especially the politicians should learn, that if you become a leader, you must be able to identify the problems your people are facing, bring it to the fore, and let people who can be able to support come and support. But when you hide a problem, in the next few generations, it's going to impact very, very negatively.
Yeah.
And I like the way they keep on saying it's a bad image. A bad image for whom? For you or for the society? Or when we try to do something good. But I can tell you one thing. There's no good deed that goes unpunished. So I'm ready to face such things. And one of the reasons why our campaign has been very, very successful is because of such critics. Because
they keep you going.
They keep us going.
All right.
Yeah.
You wrote a book earlier on and launched it, Jiggered Mind.
Yeah.
And you bring out quite a number of issues in as far as just what even our society, some of the ills that get us to a level where we are not perhaps fulfilling our best, living out to our best potential. Are there changes you're witnessing now? Is society slowly coming out of that?
Or you just asked me about people who say we are portraying negatively.
Yes,
those are the jiggered minds.
Yes.
Those are the people who distort information, who want to show that we are everything is well, everything is good, and yet we have very, very many problems. These are the leaders who are the ones who are supposed to help the communities, and yet they are the ones who block anyone who wants to support a community.
Yeah.
So that these are the jiggered minds. But it has actually changed. I can only tell you that now we have about less than 10% of those people.
Of jiggered minds.
Of jiggered minds. I think it has done very well for the last 8 years, and most people have actually now supported our campaign, and the jiggered minds are actually facing out.
They are slowly facing out.
Yeah.
So a lot of your work then it requires a lot of engagement with the counties. Is there full support across the board in as far as just integrating some of these projects, some of this work that you're rolling out at each and every of these levels? Are they easily accepting? Or
I can tell you the counties that we have talked to, they are very supportive, and we've been working together. And you know, jigger infestation is just an indicator of problems that are facing people. So any other organizations that deal with education, disability, like NACADA on drug abuse, we come together and work as a team to see how we can be able to eradicate jiggers. Because even if you eradicate jiggers, there are some people who have got jigger infestation who are disabled, who come from broken families. We have orphans. We have people who are at the bottom of poverty. Yes. So we bring together all other stakeholders so that we can all work together and eradicate this menace. Yes. And I'm very, very hopeful that in the next few years, this will be a thing of the past.
Yeah.
My next year, I want to open up a museum. I've already started collecting jiggers and photos.
Collecting jiggers?
Yeah, I have jiggers in bottles.
Real jiggers?
Yeah, real jiggers. Because I know they will not be there in the next few years. Okay. But I want our children to one day see what were these jiggers that were affecting our community. Yeah, that's what I'm thinking about a museum. And this is something that by next year should be up and running.
So many have known you for jiggers, but now with your new office for talent as well, people will come to know Dr.
Yeah. But I can tell you that I'm actually somehow also on my way out of the anti-jigger campaign.
Okay.
Because as I have said, I can't keep on talking about jiggers. So I've given myself another 2 years to make sure that I mentor more people and I groom someone to take over, so that I don't talk about jiggers in the next few years. I'm just tired of talking about one thing I cannot talk about it for 10 years.
Yes.
No. I just want to talk about something else, and I want to talk about something positive this time.
2017 is also coming up. As we wind up, would we be likely to see Ambassador Dr. Stanley Kamau's name in the ballot anywhere?
That's why most politicians are panicking. But I can assure them I'm not anywhere near politics, because the job I have now, it's bigger than a governor, it's bigger than a senator, it's bigger than a member of parliament. Maybe the only job I can take is for an MCA, because that's the job that gets with the people. And because I'm not going to that level, then I can assure them that what I'm doing, I'm serving the community as a leader also. So I'm not going to look for any other leadership. The leadership that God has given me is the one I'm going to use. Okay. So for politicians who think that I'm going to be in the ballot, I'm not anywhere near. And I've never even dreamt about becoming a politician. Okay. But politics and community work are linked. So community work is actually politics. But I'm not going to go into elective politics. But one more thing is that our people, especially the people we support, my constituency is the people who are poor. We must, even in 2017, I must guide them on the best way in issues of governance and democracy.
All right.
So if there are leaders out there who think that by hiding their problems, these are the people, 2017, we must tell the people the truth. We must tell them that this is a good leader, this is a bad leader. We know leaders are anointed by God, but we have our own opinions to tell people that this person can do a good job for your community. So we are not going to be in elective politics, but as I'm telling you, community work and politics,
they're interlinked.
Yeah.
Thank you so much for joining us. Ambassador Dr. Stanley Kamau with us this morning. All the best for the new work. You have quite a lot cut out for you. We wish you the best on that.
I have all the time to do it.
We'll be watching you. And Professor Obora tells me that he's one of the people who nominated you. You know him?
Yeah, I know him.
Yes, and congratulations on that. Dr. Ambassador Stanley Kamau with us this morning. And that's where we wrap up the show. Thank you very much. Okay, now we're back to this camera. Have a lovely day. We'll see you tomorrow.